The body, in order to heal and to fight, will need a higher caloric intake.
We live in a land of abundance and have the waistlines to prove it. But if you have a medical problem, you may be struggling to eat enough of what you need to maintain strength and help your body fight back against tough physical opponents. Food fuels our bodies and satisfies our souls. A balanced diet is one ticket to good health. But when we're thrown off by chronic or acute conditions, nutritional supplements offer help.
I was in my 40s and I started having fractures.
Rochelle Cohn is one of 10 million Americans with osteoporosis. Almost 34 million more have low bone mass. Once diagnosed, Rochelle went into preservation mode. She practices yoga, takes medication, and monitors her nutrition.
I never had a problem with calcium, but I wasn't getting enough vitamin D. Calcium doesn't get absorbed unless it has vitamin D.
Our needs for calcium and vitamin D change as we age. Before age 50, it's recommended we get 1,000 milligrams of calcium and 200 international units of vitamin D every day. From age 51 to 70, it climbs to 1,200 for calcium and 400 for vitamin D. After age 70, we need even more vitamin D, 600 international units.
Dairy foods like milk and yogurt and cheeses are probably your highest sources of calcium and vitamin D.
Doctors often suggest supplementing calcium and vitamin D, and there are other foods that can help build up bones, like prunes.
I have never seen anything this consistent that not only prevent bone loss, but increase bone mass.
In a study at Florida State University, subjects like Ina Jeffrey, who took calcium and ate 10 prunes a day for 1 year, showed an increased bone mass of 3 to 7%.
You know, most medications really don't do that, and I don't want to take medication for it.
Parkinson's is a degenerative disease caused by a loss of the cells in the brain that produce the chemical dopamine. Patients often endure debilitating tremors.
If someone has a disease that causes tremors that may increase the metabolic rate of the person, it is not uncommon for them to lose weight.
The obvious solution would be to eat more, but often patients have difficulty preparing meals and may have trouble swallowing. That's where liquid supplementation comes in.
The role of supplements is crucial to patients with Parkinson's.
High-calorie shakes, high-calorie energy bars, calorie-supplemented puddings, any of the yogurt shakes, things that are quick and easy for them to access.
People with cancer can also have trouble keeping weight on.
Cancer patients oftentimes have an increased metabolic rate. The tumors actually produce chemicals that boost metabolism and at the same time suppress appetite.
Plus, chemotherapy can leave them too nauseous to eat. Certain natural remedies help.
The herb ginger has been researched for a variety of types of nausea, including nausea related to chemotherapy.
There is another important reason for cancer patients to maintain good nutrition.
Patients who are malnourished are at increased risk for infection. So if they develop an infection, that may halt or put a hold on different cancer treatment strategies.
Any delay in treatment can put remission and recovery at risk.
Sometimes we do need to really kind of pack some calories in, and so we may create protein shakes for patients so that they're getting concentrated nutrition.
Liquid supplements may also be recommended for patients before and after major surgery.
A great deal of recovery and wound healing, and all of that needs protein and needs calorie. If you have the reserve from a pre-surgical bulk up, then you have the reserve to draw on.
Malnutrition and weight maintenance are often issues for people with Alzheimer's and the elderly population in general.
The main thing in these patients is to just make sure that they get a balanced diet and that they don't forget to eat.
I just don't remember, period.
Nearly 1/3 of all elderly Americans don't consume enough calories a day.
Multiple medications, coexisting illness, dentures, lack of teeth, gum disease, functional status. They can't walk to the refrigerator and make a sandwich.
Would you like some juice?
If older folks have diminished appetites, caregivers should aim for 5 or 6 little meals instead of 3 large ones, supplemented by calorie-packed treats.
I'll take the black walnut.
The black walnut, all right.
Like those served at in-house ice cream parlors, which have become fixtures at many nursing homes.
It's a great way, a very pleasant way to increase calories in older adults, particularly older adults who are unable, for a variety of reasons, to tolerate very large meals at a setting.
Okie dokie. Okie dokie, Smokey.
A benefit for body and spirit.